Doctors warn, these 10 silent symptoms could save your life. Every day, your body communicates with you in subtle ways. While many aches, pains, and changes are completely harmless, some symptoms can occasionally be early warning signs of more serious health conditions. The challenge is that these signals are often easy to dismiss because they don't always cause severe pain or immediate discomfort. Paying attention to persistent or unusual changes and knowing when to seek medical advice can make a meaningful difference. In today's video, we'll explore 10 silent symptoms that doctors say should never be ignored. Remember, having one of these symptoms does not necessarily mean you have a serious illness, but if a symptom is new, persistent, or worsening, it's important to consult a qualified healthcare professional. Let's begin with number 10. Number 1. Sudden weakness or numbness. Our number 1 warning sign is one of the most important because every minute matters. Sudden weakness or numbness, especially if it affects one side of the face, arm, or leg, can be a sign of a stroke. Other symptoms may include difficulty speaking, confusion, trouble understanding speech, sudden vision changes, dizziness, loss of balance, or a severe headache with no known cause. Doctors recommend remembering the word fast, face drooping, arm weakness, speech difficulty, and time to call emergency services. A stroke is a medical emergency, and getting treatment as quickly as possible can significantly improve the chances of recovery. Number 2. Persistent swelling. Occasional swelling after standing for long periods or after a minor injury is common. However, swelling that persists, repeatedly returns, or develops without an obvious explanation should be checked by a healthcare professional. Swelling in the legs, ankles, feet, hands, or face can sometimes be related to problems involving the heart, kidneys, liver, veins, lymphatic system, or certain medications. If the swelling is accompanied by shortness of breath, chest discomfort, severe pain, redness, or a sudden increase in size, it may require urgent medical evaluation. Paying attention to changes in your body can help identify issues before they become more serious. Number 3. Severe headaches or vision changes. Most headaches are not caused by serious illnesses, but a sudden, severe headache that's unlike anything you've experienced before should never be ignored. Likewise, unexpected vision changes such as blurred vision, double vision, partial vision loss, or seeing flashes of light can sometimes signal a significant medical problem. These symptoms may be associated with conditions involving the brain, eyes, or blood vessels, and in some cases they require urgent medical attention. If a severe headache develops suddenly or is accompanied by confusion, weakness, difficulty speaking, fever, or vision changes, seek immediate medical care. Quick evaluation can be critical in identifying the cause and starting appropriate treatment. Number 4. A persistent cough. Most coughs caused by colds or seasonal illnesses improve within a couple of weeks. But a cough that lasts for several weeks or continues to get worse deserves medical attention. Persistent coughing may be linked to allergies, asthma, acid reflux, certain medications, chronic lung conditions, or infections. In some cases, it can also be a sign of a more serious underlying disease. If your cough is accompanied by coughing up blood, unexplained weight loss, chest pain, persistent fever, or difficulty breathing, don't wait to seek medical advice. Even when the cause turns out to be relatively minor, getting an accurate diagnosis can help you receive the appropriate treatment and prevent unnecessary complications. We've reached the top 3 symptoms, and these are among the most time-sensitive warning signs your body can send. Some require immediate medical attention because acting quickly may significantly improve the outcome. Let's continue with the final 3. Number 5. Blood in stool or urine. Seeing blood in your stool or urine can be alarming. And while there are many possible explanations, it's a symptom that should always be evaluated by a healthcare professional. Blood in the urine may result from urinary tract infections, kidney stones, or other conditions involving the urinary system. Blood in the stool can be caused by hemorrhoids, inflammatory bowel disease, ulcers, or other digestive conditions. Sometimes, the blood is bright red and easy to notice, while other times it's darker or hidden and only detected during medical testing. Regardless of the amount, unexplained bleeding is not something to ignore. Prompt medical evaluation can help identify the cause and determine whether treatment is needed. Number 6. Changes in moles or skin. Your skin is the largest organ in your body, and it often provides valuable clues about your overall health. Most moles and skin spots are harmless, but changes in their appearance should never be ignored. Doctors often recommend remembering the ABCD rule. A for asymmetry, B for irregular borders, C for multiple or changing colors, D for a diameter larger than about 6 millimeters, and E for evolving over time. A mole that becomes larger, changes shape or color, bleeds, or itches deserves professional evaluation. Not every changing mole is skin cancer, but early assessment can help identify problems while they're easier to treat. Shortness of breath. Feeling out of breath after intense exercise is perfectly normal. But if you find yourself struggling to catch your breath during everyday activities, such as walking across a room or climbing a single flight of stairs, your body could be trying to tell you something important. Shortness of breath can be associated with conditions affecting the lungs, including asthma or chronic obstructive pulmonary disease, as well as heart conditions, anemia, or other medical issues. In some cases, sudden or severe difficulty breathing may signal a medical emergency. If your breathing becomes difficult without a clear reason, gets progressively worse, or occurs along with chest pain, dizziness, or fainting, it's important to seek medical attention as soon as possible. Number 8. Chest pain or pressure. Chest discomfort is one of the most important symptoms to take seriously. While chest pain can result from relatively minor issues, such as muscle strain, acid reflux, or anxiety, it can also signal a serious heart or lung condition. The sensation isn't always a sharp pain. Some people describe it as pressure, tightness, heaviness, squeezing, or burning in the center of the chest. It may also spread to the arms, shoulders, neck, jaw, or back and can occur alongside shortness of breath, nausea, sweating, or dizziness. If you experience sudden, severe, or persistent chest pain, especially if it's accompanied by any of these symptoms, seek emergency medical care immediately. Acting quickly can be critical in a true medical emergency. Those were the first 3 warning signs. Up next, we'll look at symptoms that many people mistake for ordinary aging or everyday stress, even though they can sometimes point to important health issues that shouldn't be overlooked. Number 9. Constant fatigue. Everyone feels tired from time to time, especially after a busy week or a poor night's sleep. But fatigue that doesn't improve with adequate rest is different. Persistent exhaustion can affect your ability to work, exercise, or enjoy daily life, and it may be linked to conditions such as anemia, thyroid disorders, sleep apnea, depression, heart disease, or nutritional deficiencies. Sometimes, chronic fatigue develops so gradually that people adapt to it without realizing how much their energy has changed. If you constantly wake up feeling exhausted despite getting enough sleep, or if everyday activities suddenly become difficult, don't ignore it. A medical evaluation can help determine whether there's an underlying cause that needs attention. Number 10. Unexplained weight loss. Losing weight without changing your diet or exercise routine might sound like good news at first, but unexpected weight loss deserves attention. If you've unintentionally lost a noticeable amount of weight over a short period, your body may be signaling that something isn't right. There are many possible explanations, ranging from thyroid disorders and digestive diseases to chronic infections, medication side effects, or other medical conditions. Stress and changes in appetite can also contribute. Rather than assuming it's normal, it's a good idea to speak with your doctor, especially if the weight loss continues or is accompanied by fatigue, pain, or other unusual symptoms. Identifying the underlying cause early can help you receive the right treatment sooner.
Don't forget to like this video, share it with your family and friends, and turn on notifications so you never miss our future health guides.